Hello, everyone. This is Ella Reuter with Becker's Healthcare. Thank you so much for joining us today for our webinar, Reimagining Care Delivery Inside Hartford HealthCare's AI-Driven Strategy. Before we begin, I'll walk us through a few housekeeping items. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have issues with audio or visuals, just try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I am pleased to introduce today's speakers. We have Dr. Premkumar, President of the Hartford HealthCare Medical Group, and Ethan Fischer, VP of Strategy and Business Development at K Health. Thank you both for being here today, and now I'll turn it over to you both to get us started.
Excellent, thank you. And Prem, it's great to be here with you and spend yet another hour together talking about care delivery, talking about AI, talking about Hartford Health. I think just to set the scene a little bit for the audience that's going to be here today, we wanted to go through, I think, 3 topics really centered around why does AI and why does AI in the consumer experience really matter in healthcare and for healthcare systems today. I think we wanted to first ground a bit, Prem, with hearing from you about Hartford HealthCare, your institution, your medical group, how you guys are organized, and how you've really set up a foundation, I think, to be pretty uniquely capable of thinking about that consumer and pushing that forward and bringing new AI tools together. We want to talk a little bit about our partnership around HHD 24/7. What is this primary care clinic? How does it work? How does it operate? What's some of the success we've seen? And then really finish up with where do we want to go? What are we thinking about when we're building these experiences? But with that, Prem, would love to have you just do a little bit more of an introduction, your background, and really where you're coming at this lens of consumer and AI within the Hartford HealthCare Medical Group.
Yeah, good afternoon. Thanks, Ethan. Yes, another hour for the two of us. For myself, my journey actually started in 2010. I grew up at Hartford HealthCare. I'm an internal medicine physician by training. Joined faculty here in 2014. Ran the internal medicine training program here as associate program director here for close to 7 years. Subsequently took on a role as vice president of our revenue cycle, which I did for about 2 years, and now in my current role as president of Hartford HealthCare Medical Group. I'm also president and CEO of our clinically integrated network here within Hartford HealthCare. In terms of who we are as an organization, I would say that the last 10 years has been significant growth for us as a healthcare system. We now have 7 acute care hospitals, soon to be 9 over the next few months. We employ close to 45,000 people across the state. We're the second largest employer, nearly a $7 billion organization. And we are now within 10 miles of every resident in the state of Connecticut. We house nearly 400,000 primary care patients. We have 500 plus locations across the state. I'd say that for us, the engine that runs Hartford HealthCare is our medical group. We have close to 2,000 providers, predominantly employed. We have more than 3,000 colleagues. As mentioned, nearly 400,000 primary care patients, but we have nearly 2.6 million visits each year, and we've grown on a year-to-year basis. The fundamental differentiator for us at Hartford HealthCare is we stand on 4 things. It's about access, it's affordability, it's health equity, and it's excellence. And I think our call to fame over the last many years across the nation has been our quality metrics. We are leapfrog A across all 7 of our institutions 2 years in a row. And last year, the healthcare system was voted the most safest in the entire United States, winning the AHA Quest for Quality Award, which we are very proud of. So significant enhancement over the last many years. And I'd say our agility and nimbleness is the key to our success, which we'll talk about a bit more, Ethan.
And Prem, I'd love to ask you one more question just about Hartford as a system, really culturally, right? As you guys think about, I think these are great numbers. It paints a picture of a provider that really covers the community of Connecticut and really covers that entire state. As you guys think about evolving your strategy, as you guys think about what do we do next, as you guys think about, where do we prioritize investment and how do we, change experiences for consumers, How has your culture helped influence that and impact that? Because that's something I hear a lot from you guys as we have our, internal working sessions.
Yeah, having an aligned medical group is truly the key to our success. I think the change management that comes with any major change, whether that's on the innovation front, on the quality front, I think an aligned medical group is key to success. I'd say that having our clinicians first and foremost involved in any of the major changes that we make, I think that's core important for us. The second is that I think we've had consumer and retail partnerships over the last many years that's really allowed us to be extremely successful. We have partnerships with Amazon One Medical, Walgreens, CVS. We have a partnership with GoHealth that runs all our urgent cares in the northern part of the state. We also have partnerships with TytoCare when we do some virtual care in the brick and mortar using the TytoCare technology. And I think the partnership has given us a little bit of a chassis and this arm of being able to innovate and change, which inherently, just as a healthcare system or as a medical group, you may not have. And finally, I think the Center for AI Innovation for us, we again have this infrastructure which allows us to understand what's the problem we're trying to solve, what are specific use cases, and we have specific operational teams that connect to understand how do you execute these use cases, how do you determine outcomes that come with them, and then how do you implement them to have long-term change and sustainability that we need to have. And I think with all of these things, it really allows us to really be in the consumer experience world, but also be in the provider experience world where we're enhancing what our providers have on a day-to-day basis. So it's this conglomerate of what we've created over the last many years that's allowed us to be successful.
And Prem, I want to double click on two things you said, right? So you mentioned from a partnership perspective, you guys work with a variety of people, right? You work with Amazon One Medical, underneath a very, very large organization. GoHealth, I know you've worked with for a very long time, since maybe they were earlier on in their journey to now quite mature. You work with folks like us, K-Health, in a startup environment. What does partnering in healthcare look like for you? What has it meant for you? What are some of the challenges that you've had to overcome? And how do you think about, because I've seen you guys as a very unique player out in the market that really actively looks to partner across all these various capabilities you may not have in-house.
Yeah, I would say first is we're a true believer in that we want to create multiple front doors for access. When I say we stand on all four fronts of access, affordability, health equity, and excellence, I truly mean that. And the partnerships have allowed us to be successful in all four of those realms. Specifically from an access perspective, the ability to create these front doors allows us to provide a consumer experience for our patients that everyone is looking for this day and age. I think the retail partnerships for us, we see that our consumers of healthcare today want us to be there when they need us, not when an appointment becomes available. And that's a fundamental shift in our mentality and thinking over the last couple of years that we didn't necessarily have, I would say, 5 to 10 years ago. The second thing it does is I think that the partnership has allowed us to see how each partner sort of looks at the world a little bit differently, how they provide care, what technology that they use, and has allowed us to sort of evolve what we do from a clinical and healthcare perspective in our medical group or within the acute care hospitals. And I think that the third is that we have different models that we use in all of our various partnerships, whether it's a joint venture partnership, whether it's an MSA relationship, whether it's just a clinical partnership that we have. And I think that allows us to have all various facets within the organization where we can go out and partner with anyone and not be encumbered by, we only do this. And I think that's why the beauty of all of these relationships has allowed us to, again, be successful.
Yeah, and I'm assuming, and from what I've known from our working relationship, really having that aligned medical group also helps you bring that story of the partnership together, helps you cascade it, helps you make change. As you're mentioning, bring the right clinical leaders to the table and saying, hey, this is why we're doing this. This is why we're making these changes. This is why we're going and working with someone else. That alignment really helps with communicating the message and ensuring, I'll call it, success comes along with those partnerships.
Yeah, fundamentally it's about the patients, right? That's why I went to medical school, and that's why all the providers that we employ, that's most important. And when you put the patient at the center, a lot of the questions that we get is that, is this going to make it discontinuous care? Are patients' care going to be fragmented because all of the various things that we provide? We actually think that care is far more integrated and aligned. We are one unified electronic medical record. Any partner that we have connects within our EMR. And again, it goes back to what the patients want. Patients want their questions answered. Patients want care when they need it. And I think if you can put it in a way where our providers feel like you can offer the patients what they're looking for, I think there's significant buy-in. And many of our providers are involved in the partnerships early on, and they don't feel like I'm hiding anything on the back end. It becomes this front end, do this with me because it's right from a patient care perspective. And our providers really feel like there's engagement across the board.
Excellent. And I think those combinations and this framework and this chassis that y'all have built is really, I think, the foundation for our partnership with 24/7. And so I wanted to shift us a little bit to talking through what is the 24/7 model? What's been some of the impacts, some of the success? Why does this resonate with your leadership? And I really wanted to start out, maybe I'll start out here and then ask you to kind of pile on and bring in sort of the HHC perspective. Yeah. But, we at K have been working with health systems for the last 3 years now. And this was something that wasn't kind of native or in our DNA as I'm, drilling you about partnership. It was something that we had to learn because we had historically been a direct-to-consumer company. We'd offered a 24/7, 48-state virtual primary care clinic, leveraging a lot of what we built from an AI standpoint as well as a medical group that we built. And we really saw a lot of alignment with health systems in saying, how do we take that core technology infrastructure? How do we take that clinical AI that we've built? And you take that care delivery model that we built of how do you deliver 24/7 online, always available primary care and bring that together with the system. Because ultimately, I think you mentioned a pretty critical point, right? Having patients with a continuous medical record, having patients who are able to navigate and connect to all the right points of care, that's really, really hard when you're in a standalone world, but it's really, really easy and really, really powerful when you're able to work within a health system and a health system like Hartford, where you're able to connect the dots between specialty care, inpatient care, primary care, and really meet those patients where they are. So we've been really proud of what we've built here at K and working with 6 different health systems to date to really bring kind of 3 components together. First, we've built a consumer patient experience that is really engaging to connect with the patient, be always available, be there 24/7, but also leverage some of what we built from an AI standpoint for triage and investigation, and taking those components, really placing them where folks seek care. Prem, we rolled out a new project of embedding all of this natively within MyChart after launching our standalone mobile application. We've seen a lot of success there. But we also think about this as how do we build those care pathways when someone calls the access center, when someone can't get into their office, how do we build this way that this great experience can be sitting there front and center for a patient? We at K also bring technology on the back end. We are also on that same mission of how do we support providers, both delivering high quality medicine, but delivering that medicine in a way that's productive. As we know, economics and healthcare aren't getting any easier to navigate, especially, recent government shutdown and potential changes to Medicaid and the ACA. And so we're really thinking about how do we enable our providers to deliver that high quality medicine in a way that's going to allow them to be efficient, in a way that's going to let them take their job back, right? Really take back, and Prem, I'd love for you to speak more on this than myself as a clinician, but really be able to take some of that cognitive load off of how they're working through their day. And us at K, we're really focused on the clinical side of things. How do we help take some of that clinical cognitive load off? And then finally, we've got a third component of this model, which is this 24/7 clinic. I think a lot of health systems and a lot of institutions have experimented with, okay, let's try virtual care. Let's think about how we build an after hours clinic. Let's think about how we support our brick and mortar network. And I think that's a really good foundation. But what we're trying to do together here with 24/7 and with all of our other health system partners is how do we elevate that? How do we take that for a way that a patient's not just coming in for that acute need, but that patient's coming in and able to build a longitudinal relationship with the system, whether they've been there for 25 years or whether this is their first experience. How do we create that ability to come back? And so kind of underpinning this clinic from our perspective is how do we build AI and native AI into both the consumer and the provider workflows that is going to enrich and enhance the experience and delivery of primary care. So that's a bit of the model. I'm curious why, you were one of our early partners. We moved very fast together. How did you at Hartford think about this? How did you think about taking the service line? Like, what was the decision making, guys?
Yeah, it again fundamentally goes back to what's the major differentiator, and that is access to care, right, Ethan? And for us, we felt as though we have 73 primary care offices. We have close to 300 primary care providers. There still isn't enough access to care for what our what our patients want from a primary care standpoint. So we originally started with some bare bones of a virtual program. I think we had sort of 6 folks that are working on that primary care platform, and we felt like we were making a little bit of a dent, but we really didn't scratch even the surface of what the needs of the community were. And we really felt like we really needed to scale. And we felt like partnering with K-Health and Hartford HealthCare really allowed us on the patient front to create access 24/7, which is what we were looking for, sort of that retail consumer experience, which we think is what our patients need. And I think the second thing we've sort of realized is that we had to make our providers' lives easier. And, with the amount of information that our providers get this day and age, both from the electronic medical record and outside, a patient visit isn't as easy. And we felt like we really needed to go down the technology front and on the AI front. And partnering with K-Health has allowed us to sort of push on that front as best as we can. And I think we've made significant progress. There's more to be done, but we feel like our providers on the platform really feel like there's an ability now to make patient care simpler, easier, give them what they need. And I think patients are happier because whether it be on the ambient AI front or the ability to information gather, that allows on the cognitive side, the differential diagnosis, the treatment, the prescriptions to be much quicker. And that allows the experience in the app for patients to keep coming back and also makes the experience with Hartford HealthCare as best as it can be, which is ultimately what we're looking for. And that's the reason why I think we've pursued it. I think you can do so much, whether it be transitions of care, whether it be care gap closures, whether you're in a value-based environment, whether it be follow-up for an acute care visit. I mean, there's so much that we could do, all of which I think is powered by what K has done and in partnership with Hartford HealthCare.
Yeah, and if I synthesize a little bit, Prem, I heard really 3 things from you, right? And it's all centered around the patient. First is we need to be giving them access 24/7 whenever they demand it, because if they're not seeing that access, they're not going to come in, right? And that's going to be worse quality care for them because they're going to delay something, they may fragment care, et cetera. 2, you're saying we want to give our providers the tools to be as present, as high quality, and as engaged directly with that patient as possible with all the best information. And that helps create a patient experience in that care delivery moment that is real, is connected to them, is meaningful. And then 3rd is saying, okay, if we have that great chassis, where do we go point this? Where are the different access challenges we might have or access opportunities we might have that we can use something like this to actually go and achieve? And, we launched back in March. So we've been up for, has soft launched for about a month and then have really been scaling for the last 6 months or so. And I feel like we've been pretty successful. And want to share a couple of stats of where we're at today and then get your perspective and also your medical group's perspective on what's worked well so far. So in the first 6 months, we've seen over 15,000 unique patients, with about a third of them are actually returning and coming back and continuing to use the service. Obviously, we don't want our patients to be constantly sick and having to use us and having to see us, but we're seeing this as an opportunity that patients are engaging longitudinally and building that loyalty and experience. I think another thing that we're really proud of early on is that about half the patients that have used the platform actually did not have a primary care relationship with Hartford prior to using HHC 24/7. So we've seen this as a new opportunity to really create, again, loyalty, but also to create an experience that's meeting people who may not have that relationship yet and may need it. And I think one that I'm really proud of, and I remember from one of our early board meetings, we were, I think, positively surprised about is the amount of government payers that are actually leveraging the service. Our Medicare and our Medicaid is about 40% of our book of business. And actually Medicaid being about 22%, I think we were all really, really pleased to see how this is creating kind of equitable access and not just access for, one population or another. So I think the numbers are great. The numbers are a good starting point to capture kind of the value of the clinic. What have you seen? What has your medical group seen? What's gone really well? What are opportunities for improvement from your perspective?
Yeah, I think in addition to the data here, Ethan, what you're not showing here is the far expanses of the state and the highest density populated areas of the state that we have touched. It is enormous. And I think there are patient stories across the board that we could tell where folks that couldn't get access to care or folks that couldn't make it to an appointment, we now offer them an ability to see a provider, which I think is fundamentally the most important thing, right? So I think for us, what this has essentially done, I think, is it's sort of opened up access across the board in across the state of Connecticut, where we're not talking about building brick and mortar offices year after year. Our ability to recruit to a brick and mortar office If folks on the webcast today will tell you recruitment in primary care is as difficult as it can be, but recruiting on the platform can be a slightly simpler because you're giving them a work-life balance, which I think is easier. That has definitely, I think, made it easier. Our ability to incorporate AI, I think, has also made it easier for folks to function on this, which then allows for us to serve the 20,000 plus patients that you have seen. So I think for us, we've been able to integrate all of this within the medical group, which I think has made us a better primary care platform over the last couple of years. And we've seen significant successes now because now we can build on this because we can add all the various things from a care delivery, as I was talking about before, whether it be annual wellness visits, whether it be transitions of care, whether it be follow-up for your chronic disease, whether it be prescription management, all of which just layers on. Today, those are MyChart messages to our providers or phone calls to the office and or in-basket messages, which I think this is why people don't want to go into primary care this day and age, right? So for us, it's about making the lives of our providers and patients easier, which is what I think the data clearly shows.
Yeah, and I'm seeing a question in the chat that I'm going to piggyback into that ties everything to a lot of what you're talking about, which is around how do we bridge the 24/7 with the brick and mortar providers? How do we get their buy-in to access? And I'll extend the question a little bit too, just to be a bit more thought-provoking. You know, Prem, you and I have talked about this. You know, we want this to be a longitudinal clinic. We want patients being encouraged to do their primary care remotely and be able to do their primary care continuously with this 24/7 team if that's the path they want to go down. How do you think about that change? How do you think about that innate, I'll call it friction, when there's potentially, you know, challenges with the brick and mortar providers? How have you helped manage that change? I'm curious your thoughts there.
Yeah, so I think Maggie is the one that asked the question. I think it's a really good question. So Maggie, if you look at over the last few years, I think the patients already have alternative access points that have already been created, right? So when you look at our urgent care clinics across the state of Connecticut, folks are already going there for their urgent care needs, despite having a medical group provider as their primary care physician, right? So I think the alternative care points already exist today. I think what we have tried to sort of tell patients is that, you know, we're able to provide you with a primary care experience where the connectedness between your virtual visit and your primary care physician can occur. And we've sort of said that the single thread there is the electronic medical record, the continuity that you're going to see. And if patients feel like that they're brand new to the app and they want to find a primary care provider that is truly virtual, as Ethan was talking about, we're able to offer you a primary care provider online. You don't have to come to a brick and mortar. And I think that that's the beauty of what we're trying to sell. I think that folks want flexibility. This day and age, we have several patients that don't necessarily want to come in for a singular visit that sometimes can get rescheduled or canceled. And folks are looking for, how do I interact with the healthcare system in many different ways? And I think that that's what HHC 24/7 offers us. You can have a panel of patients. We can see you for same-day conditions. We can see you for your hypertension and diabetes. We can see you for your health and wellness questions. You don't have to rely on ChatGPT to answer things related to your obesity and medical weight loss. And we now have medical weight loss incorporated directly into the primary care program in HHC 24/7. I think that's where we're trying to get to. And I think that's the beauty of bridging the virtual visit with the in-person. I think that our providers originally, they feel as though that, that this was, again, discontinuous care many years ago, even when the urgent cares came live, but they're seeing that patients want care when they need it. And we're not available to them on a Saturday at 8 p.m. at night. And unfortunately, patients get sick. And I think that this is the beauty of how we've been able to blend the two together.
Yeah, and Prem, I think you also hit on a unique part of this model, or something that we're excited about continuing and expanding further, is that the problem in access isn't one that solely resides in primary care, but it's one that resides across the health system, across specialty care, across acute care, et cetera. I'm going to explain a little bit more about our partnership on medical weight loss, because I think that's I think we have more to do there, but we have a lot of exciting bones as we're thinking about how can we use a platform like this to both serve as an engagement and triage moment for a patient. So imagine, we've got a bunch of Hartford HealthCare patients that may have some risk factors, whether that's high BMI combined with hypertension, combined with CHF, combined with diabetes, whatever that clinical piece looks like. we're now able to use 24/7, engage that patient about their weight, leverage the conversation with a primary care clinician to say, actually, Dr. Premkumar, you are needing to go see one of our bariatric surgeons, one of our subspecialists in metabolic weight loss. How do I actually escalate that into our specialty institute in a really seamless manner so that you're both able to capture those patients that really need primary care management for something that's going on with them, whether that's on a GLP or not on a GLP, whether that's for also talking about their CHF or also talking about their diabetes, but it's also creating a really, I'll call it qualified escalation into that subspecialist. So those subspecialists are getting to see those patients at the right time when they really need their support. And then also being able to help make that relationship work backwards, where we're able to decant folks, where folks who have been managed in that subspecialty but are pretty well managed, maybe they met some of their weight loss goals, they still need to be cared for across all their comorbidities. It can be an opportunity for something like 24/7 to support there. And I know we're thinking about that across other specialties, but I think that a chassis like this helps us not just solve that primary care access problem, but also think differently about how do we build the care network and the care pathways throughout the system.
Yeah, I think if you extrapolate that a little bit, right, Ethan, when I talk about the retail and consumer experience, when you look at all the drugs that are offered for medical weight loss today, what we're inherently saying is that there potentially is a flaw there, but where it's not about just offering the drugs, right? So when you think about a comprehensive obesity program, which includes managing your chronic disease condition, which includes ensuring that we appropriately determine what your BMI is. We appropriately determine which drug potentially could work with you. Are you a surgical candidate or not? There's so many different things under that umbrella. And it's a navigation point that I think that the expertise that the HHC 24/7 offers is we're offering a comprehensive obesity management program. It's not just about the drug. We're there for you if you are on a drug and you have side effects. We're there for you if you feel like surgery is an option. We're there for you to manage your whole life condition, because we have all of the various services that are available to you from start to finish, which I think is the beauty of the app and the brick and mortar, which they can get connected to if they want to. So I think that's what our medical weight loss platform, but it's a comprehensive obesity program.
Yeah, exactly. And I think that ties in nicely to where I want us to head next in terms of the conversation. So the title of this webinar was Reimaging Care Delivery in the Age of AI. How do you think about consumers engaging and using AI? We talked a lot about care delivery, but we're still scratching the surface on the AI side of things. I would love for us to pivot towards, as we think about 24/7 now, we think about 24/7 in the future state, we think about Hartford HealthCare in the future state. Where might we actually take this chassis, and where are you really thinking a lot about how do I bring more AI to consumers, to my providers? What does that actually look like? What do we need as a system? What does our system need to look like to meet those different access needs of our consumers? Because they're only going to get, I think, larger. You mentioned the GPT example, as patients are going to go find some other, patients are going to find somewhere to answer their medical questions, whether it's with a clinical entity or not with a clinical entity. How are you thinking about this more broadly? I know we've got a couple buckets around experience, capabilities, integration, but would love your initial thoughts.
Yeah, I think first is I think that you can't find enough patient navigators in a healthcare system to navigate a patient. I think we can all on the call today sort of say that healthcare, the healthcare journey is convoluted, it's difficult, and from a consumer experience perspective, it's probably the most difficult thing to navigate. So I think that one of the things that we have been looking at is trying to use technology, artificial intelligence, I think specifically from a navigation standpoint. And the navigation can be as simple as someone has a breast mass on an imaging that they need a biopsy for on a Friday at 9 o'clock when there's nobody to call, but you're spending all weekend worrying about the fact that you have a breast mass. Right? And today we have oncology navigators, we have all kinds of things that we have built, but I truly think that this personalized medicine from a navigation standpoint, I think is one of the keys to our success. The second thing is, I think we have to continue to enhance what we have done, Ethan, with regards to the information in the electronic medical record, making it simpler for our providers and our patients. I think that the ambient AI, and we partner with a Bridge, again, another partnership for us, in terms of using that to make our providers' lives easier, getting information quicker, I think is something that we want to continue to partner on going forward. I think that is, again, a tremendous key to our success. The third thing is we believe that incorporating AI, whether on the conversational front, the Gen AI front, wherever you want to go, needs to extrapolate into our brick and mortars. Because the technology that we have today it can't just be about the virtual world getting better, but it has to be making the brick and mortar world get even better. When our patients walk into our office, we truly believe that it should be a contactless office. You should be able to go get your visit. Information should be seamless. Your provider should see you. There has to be this constant eye contact. You have to have that experience that makes you feel like you want to keep coming back. And that's what we're looking for. So those are the three things. I think that long term, whether it be remote patient monitoring, gap closures, I think there is a level of automation to chronic disease management that we can provide, where whether it be hypertension management, CGMs, continuous glucose monitoring with diabetes, these are things that we could do, but we want to utilize technology and AI in the long run. Those would be the four major things that comes to mind in terms of the future. Your thoughts on where K is taking in terms of AI and experience?
Yeah, and I think there's a lot of alignment between how we both think about this and both of our organizations think about where we need to go. And I think it's part of what's made this a successful partnership to start out. I really think of it in three buckets. So I think similar to you, the first bucket of how do we change the way in which patients are able to engage with healthcare is probably the biggest problem in healthcare out there right now, right? If you think overall economics backgrounds, you're going to hear a little bit of this, popping out. But if you think about overall supply and demand, we have a very constrained, very specialized set of supply that is not like an Uber driver. I can't go and find a marketplace of, hey, one Uber driver will drive me, the next 10 minutes down the street. It's very, very specialized. And making sure that you have a patient actually connect right into that correct specialty, match right into that correct management is tough because a patient also doesn't quite know what's going on. You have to bring that information out of them. And usually that takes using that high cost, highly specialized labor to do so. So I think a lot of automation and advances in AI and things that we're working on from a consumer standpoint is how do we better engage with patients, better proactively get to them, better proactively say, hey, we need to come in and talk to you about something. We need to proactively monitor something about you. And then two, creating a conversational and dynamic way for that patient to actually tell their story. Because a lot of what your training has done for you is taught you what are the pieces of information I need to collect in order to make a decision about what's going on with my patient. And with the advances in technology, what we're building from AI, it's actually much easier to collect a lot of that without a human in the loop. You need a human in the loop to do decision-making at the moment, but you don't need a human in the loop to collect that information. And so going to your navigator example, we're really thinking through how do we take the 24/7 experience, truly 24/7, having it conversational, having patients be able to use this as their everyday experience with their health, because it's then connected in with the second big component, which is the provider. It's connected into care delivery when it needs to be there, whether that's with a 24/7 provider, whether that's with a brick and mortar provider, whether that's with the most esteemed subspecialist in cardiology that this patient needs to get to. We need to be able to facilitate that connection to care when appropriate. And as we think about it from the case side, what are we building in I'll call it the provider world? One, it's absolutely what you mentioned around tools for workflow and productivity and quality and burnout. And how do you just help synthesize and collect and present this information really relevantly at the point of care from all these disparate sources, right? Whether it's that patient intake that we're collecting before the visit, whether it's the medical record, whether it's the actual visit interaction and the transcript of that. All of those are important elements to know how to synthesize and turn into something a physician can use for decision-making or an advanced practitioner can use for decision-making. But we also want to get better in other specialties, right? We've focused on primary care to date. Primary care is some of I would say the harder problem because you have to capture the whole world of medicine. And so now saying, how do we in certain chronic diseases, how do we in certain really subspecialties think about building models, predictive models, diagnostic models that can help really lead towards, again, automating more of that clinical decision-making. So you, Dr. Premkumar, can walk in the room, have a full picture of your patient, know what's going on. That patient's going to be really highly engaged and qualified for you to be there. And you can use your clinical judgment to make the right decision and the right path for that patient. And then I mentioned three buckets. You make fun of me for all of my bucketing of my different ideas. But the third option or the third opportunity is, okay, if we've enhanced this experience and engagement, if we're delivering more and more clinically relevant tools, not just administrative tools to providers, then we're saying, how do we wrap all of this up in care delivery? How do we wrap all of this up with actually designing what care delivery looks like across all these different specialties, across the inpatient to outpatient transition? All of that is, you can build all the technology you want in the world. You can build all the great tools to engage patients, to support providers. But ultimately, if you're not stitching them together with the care delivery of a network, I think it's why we enjoy partnering with health systems so much, is we see so much opportunity to stitch together the different pieces of the ecosystem in a better way and design that care delivery. If you could design around an infinite access world that allows you to do very different things with patients and help them be, the center of their consumer journey, than if you're in an access constrained world. So that's a bit of how we're thinking about it. And I think largely aligned with where you're trying to head as well.
Agreed.
So I know we have a couple questions in the chat. Maybe before we go there, Prem, one last one for you. We've been in this relationship 6 months. We're hoping to be in this relationship together for a very, very long time. Where do you want to see the next year take us? Where do you think we can head in the next year to really impact care within the state of Connecticut, but also impact all of the different consumers and patients in their experience with Hartford HealthCare?
Yeah, a couple of things there, right? I think that's a great thing, Ethan. First, from a patient perspective, I always, to the medical group and Hartford HealthCare, talk about membership and loyalty, not things that are common in medicine, but like today with the advent of Amazon and Google, these are fundamental concepts, right, in the day-to-day world. And I always talk about, patients have to keep coming back from a membership and loyalty perspective because you're offering them a level of service that doesn't exist anywhere else. And for us, we see HHC 24/7 as the platform in conjunction with Hartford HealthCare to offer that to our patients. I think so that concept of membership and loyalty is a big area of focus for us. The second is, I think there was a question, I think Joanna might have asked about, we feel like we want to enhance the virtual experience to include many different facets of healthcare, not just primary care, but the primary care is the centerpiece of a lot of different things that we offer, right? Whether it be, as mentioned, oncology, our neuroscience platform, our digestive health platform. I think there's much to do there. And the third piece is, where do I see this next year is the paneling of our patients, increasing our visit volumes, but definitely getting that navigation and that human experience through the app, I think, is a very important thing that I want to see us get to this next year. So those would be the three things that sort of vision for us this next year, so that we can enhance patient care both on the brick and mortar and on the HHC 24/7 app.
Excellent. Well, I know we've got a bunch of questions in the chat, and I might ask the Becker's team to kind of tee us up for where we should head next, and really make sure we're answering kind of what everyone's minds are on right now. But I think, Prem, like what we've built here together is a really great proof that the technology world and the care delivery world, working hand in hand, are going to create the types of experiences that consumers need out of the health system, help change that health system to, you and I were talking about this last week, how do you become the health and wellness system for folks that are also combining some of that wellness in with other places they seek care, and really helping create access for patients? So with that,
Absolutely.
maybe Becker's team to tee us up with a question.
Thank you so much, both of you, for such a wonderful discussion today. We will now begin today's Q&A session. Audience, please feel free to submit your questions via the Q&A box on your screen, and we'll get started with our first question. Our first question comes from Steve. He says, are patients attributed to the 24/7 platform? And if so, are they attributed to a specific clinician or just the platform/network as a whole?
So maybe I can start, and Prem, you pile on here. So yep. A couple of concepts around attribution and kind of continuity of relationships with patients on the platform. So the first concept we have is something that we call an assigned provider. This is not and attribution from an insurance perspective or insurance relationship. But this is the concept that if I go see Dr. Premkumar on 24/7 today, I'm going to have the ability and the affordance to continue to see him when I come back to 24/7 in the future. My needs may be at a different time than when Dr. Premkumar works. It may be, a different hour. I may have a different sense of emergency, but we want to make sure that there is some form of continuity, even within the 24/7 model, if they're not using it as primary care. Because our premise of the best medicine is going to be one that the patient has a continuous relationship with the system. So that's kind of part one. In terms of part two, I would say we're experimenting around with the two different models in terms of, I'll call it payer attribution, whether it's a patient that should be impaneled and attributed to Dr. Premkumar on the platform, or whether it's the kind of clinic as a whole, the 24/7 department as a whole. Because I think one big part that we've been working through in terms of attribution, in terms of impanelment, is how do you create those pathways in the brick and mortar when it's needed? There are circumstances when we need to get labs, we need to get diagnostic imaging, we need to make sure a patient gets into a specialist. There's times when someone does need to lay hands on a patient. We need to make sure those pathways exist, such that when we're paneling folks, they have really seamless and coordinated access into the brick and mortar. But Prem, anything you want to add there?
No, I think just for clarity's sake, right, we only went live with HAC 24/7 in March of 2025. So the data that you're seeing is only a few months old. So for us, we're right in the midst of talking about paneling directly with the provider on the app. We've also talked about adding a virtualist onto our care team within the brick and mortar, where we can deal with retirements, folks that are leaving departed providers, so that our patients have the ability to work within a care team that includes a virtualist. So I think both models, but definitely attribution specifically to a provider is sort of the model that we're working with.
Wonderful. We'll move on to our next question. For Dr. Premkumar, for health systems who are earlier on in their AI journey, what's your advice for using AI to truly enhance the consumer experience and strengthen patient relationships?
That's a great question. I think a couple things there. First, highly recommend a governance structure from start to bottom. We have an AI executive steering committee that meets on a weekly basis. Anything that is an AI venture that anyone comes up with sort of is worked through the work group, goes to the AI governance committee in order for vetting and approval to determine if this is a pathway that we're going to go down. The second is highly recommend having AI policies built out in any healthcare system that provides guardrails for anyone coming into your healthcare system or clinicians working with the AI, so that you have protection on all fronts. The third thing I'd say is have clinicians involved early. So in our AI governance committee, it's led by a physician. It has advanced practitioners and physicians in it. It really does give you that clinical lens and eye that allows you to determine if this is a product that you want to implement. But the second thing it does is, because everybody's involved so early, the change management isn't through myself or Ethan. It's through the providers that are actually doing the body of work and that are implementing it. And it means much more to the frontline clinician as to who this information is coming from. So it doesn't become a top-down effect. So those would be the three things that I would say as basic tenets that you should have that allows for you to get any AI venture part of your healthcare system.
Wonderful. Thank you so much for that perspective. And for Ethan, you've helped launch similar AI-enabled clinics with other systems. What are the top lessons or success factors others should keep in mind when building similar capabilities?
Yeah, it's a great question. And I think Prem sort of articulated sort of a couple of the foundational pieces that you have to understand as someone coming in and working with the health system of how to make that change happen. So I think one is really understanding the process by which innovation happens. Understanding, hey, Prem, we've got weekly meetings with your AI governance team. How does this actually get approved, reviewed, vetted, so that you can really match that governance process and be a good partner from your own side? I think the other piece that matters a lot is how do you build trust, not just with senior leadership, right? With senior leadership, I think the goal is always, what is the vision? What are the set of shared mission statement we have about this? What is the core principles of experiences we're trying to create for our patients and for our providers? All of that is really important because that creates a consistent set of messaging that cascades across an organization of why are we doing this? Why are we doing this partnership? Why are we doing this new initiative? It keeps everyone on the same plane. But separately, when you have that clear line of sight as to why you want to do something, then being able to go through the blocking and tackling and day-to-day work as folks are building their own experiences and trust with whether it's 24/7, whether it was the process of implementing, that human kind of relationship and connectivity is the part that will actually make a partnership succeed. And that trust that you're ultimately building and being open, calling each other out when something isn't working well, working to address feedback, and also recognizing when things are going well, I think really helps create a sense of trust that allows, okay, great, we have the right principles and goals. We have the right champions that are working through, building, testing, validating internally. And then we also have the right level of trust as partners to go in and build something larger together. I think those three principles matter significantly, and they're a bit softer. But I think the softer part is what enables like change and adoption of new things to actually happen versus the amazingness of the technology itself. And yes, that does help, right? Have good technology, have a good idea, have good care delivery, but having that baked around a culture of change and trust is pretty important.
Wonderful. And we have another question from Ruben. As AI tools move closer to the bedside, integrated with monitors, pumps, and edge tech devices, how are your organizations balancing real-time decision support with clinical trust and alarm fatigue? What guardrails do you see as essential before these systems can make autonomous recommendations in ICU settings?
Yeah, so I could take this one, Ethan. So again, for us, part of what we have tried to create over the last many years is sort of an intake process where we're clearly able to define what we're deploying within the healthcare system. I think part of where the organizations run risk is when you're implementing multiple things because multiple different folks in the organization are all siloed and everybody's implementing something different. And so with our clinical informatics, our IPS, and with our clinical partnerships across the healthcare system, we've tried to create one governance structure where intake is singular, which then allows for you to determine what's the organization's priority. So in your question, you could go in two ways. My priority is the acute care hospital, and I want to focus in the critical care setting in terms of pumps, monitors, and devices. Or my priority is remote patient monitoring in the ambulatory setting where I'm focused on gathering blood pressure, weight, and diabetes glucose monitoring, right? And so it's an important fundamental because the audience that you reach is very different, right? And that singular ability to determine where am I going, what am I implementing, who am I educating, and what's the feedback that I'm getting at the ground level becomes a very important piece of the puzzle. One of the things that, again, I'll go back to saying, having clinicians involved early allows us to determine with what we're implementing, whether I'm going to cause alarm fatigue, where I'm going to cause significant backlash because folks don't like it, and I'm getting real-time feedback in terms of where we're going. And I think that those are the things that I think you need to put into place before you can start to go out and say, I'm going to do RPM, I'm going to do AI, you can do anything this day and age, but having that layer of control, feedback mechanism, and closing the loop, I think becomes important before you enact anything. And so I think the EMR is a great example, right? We went live 15 years ago and we turned everything on. This day and age, we're trying to figure out, okay, what should we have turned on and what can we enhance with all of the various third-party things that are coming into being. So I think that's sort of how I would approach that question.
Great. And our next question is, how can developers balance empowerment, self-help, and learning with protection, avoiding harm from overconfidence or misinterpretation?
Yeah, maybe Prem, I can start on this one here. So it's a good question, and it's one that I think we've had to be very cognizant of in the fact that we're putting information in front of clinicians in a real-time clinical context. So we've thought through this really in three ways here at K. So kind of first principle that we have is we always have a clinician in the loop right now. right? No matter what's happening in terms of, information gathered, how straightforward a case may be, all clinical decision-making is happening from that provider themselves. And so what that requires us to do is that requires us to appropriately train our providers and the providers using our tools on how does this actually work? How does a predictive model work? What has actually been the evidence of this? What has been the studies of this? Doing that education of where the limitations exist as well also helps, I think, really set up providers to use these tools successfully. Because ultimately, everything in life is an expectation game. And so if you're able to tell someone, hey, right now we're really excellent at doing A, B, and C, we're not so great at doing D, E, and F, and we know that, giving folks that context as you're training them is really, really important. So if part one is saying, how do you have a clinician in the loop and a clinician who knows how the tool works and is informed on it? Very similar to what Prem is saying is how do you have clinicians throughout the process of bringing these tools to life? I think the second component is doing very robust research and validation on what it is you're putting out into the market, even absent the clinical side or the clinician kind of feedback and review. So we've done a lot of peer-reviewed research. We've published in the Annals of Internal Medicine, thinking about things around diagnosis and treatment. How accurate are our models in certain conditions? How do we know when to surface relevant information to providers? And actually having those thresholds of, hey, I know I'm not that great at observing. Let's take a virtual scenario as an example. Remote care isn't the most natural setting for resolving orthopedic complaints. And if we know our models are not great at that, we need to be able to not surface a falsely courageous opinion about it, but be able to say, hey, in this case, I've gotten all this information from my patient. I've given it to you, provider. I don't have an opinion on what potential diagnosis or treatment might be, because this isn't something that I'm that great at. But you can take all this rich information that my AI has collected for you and make your decision. And then I think that the third piece is really around the ongoing monitoring. And understanding what different AI tools are useful for different purposes. Using a Gen AI tool for diagnosis, like actually doing the predictive diagnostic capability, isn't smart. It's not the right it's not the right tool for the job to be done. And so we focus a lot on, okay, if we're using something like Gen AI, that can help facilitate a conversation, that can help synthesize information, present it, collect it. But in terms of actually taking that information and making a predictive, capability on it, that's an entirely different set of models. And so we have to be able to first determine which model makes sense for the use case you're thinking about, and then say, okay, based on that use case, how am I actually going to monitor that over time once it's deployed, so I can know if something needs to be corrected. So really those three elements of how do you actually train and onboard the folks that are in the loop with these tools? Two is how do you do the research and the kind of, I'll call it peer review rigor of how these tools work and being able to explain where they're really good and where they're not. And then third, knowing how to pair up models into the right use case, as well as keeping a tight monitoring scheme on them after you've deployed, are all critical for making sure that these are being used in the right way out in a clinical environment.
Ethan, if I could just add one last thing to that. I think one of the fundamental things that I'm very careful of is look, automation is coming. I get it. However, with that being said, the goal here is not to replace the human, and it's not to replace the provider to a certain extent. And so even when we rolled HAC 24/7 out, it's ultimately the provider who's responsible for the output of the documentation and the coding and billing that happens on the back end, and the quality and the patient experience that the patient receives. And that is a core important thing here. And that's why it's important to test with clinicians. It's important to roll it out with them. But ultimately, the information that's given to them, it's ultimately still the provider's responsibility to ensure everything is accurate on the back end.
Wonderful. We do have another question from Maggie. Can you elaborate more on the quality of care provided through your partnership with K-Health? Have you had to be limited in what you allow patients to be seen, for 24/7 to maintain quality and lower risk for any negative outcome?
Ethan, I can take this if that's okay with you.
Perfect.
Yeah, so it's a great question. First, and fundamentally, one of the major decisions that we made is all the providers on the platform, all of whom are family medicine trained primary care providers, is that they had to be employed within the medical group. And the reason why we intentionally made the decision is because we infuse the culture of the medical group to all the providers that join us, whether it's on the quality front, the patient experience front, or the access front, which I think is the most important thing. The second thing is we have all of the guardrails that we do in the brick and mortar applied to HAC 24/7. So anyone who joins new on the platform gets an art and education audit as soon as they start. We do multiple chart review, we provide feedback, there's quality control on the back end. Similarly, we have a coding and billing audit that happens on the back end to ensure the coding and the billing matches the documentation that's submitted. Third thing, we have medical directors on the platform, both within the medical group and on HAC 24/7, who perform chart review cases with our providers on a day-to-day basis, and then really check things on the quality front where we get feedback. And the fourth thing is, remember, a lot of these patients are our patients of our primary care providers on the brick and mortar front. So we have checks and balances on the back end. So if there's something incorrect, then clearly there's feedback provided on the front end to make sure that there's a continuous environment of learning. But the beauty is we're one team providing care for our patients across the state.
Yeah, and Prem, if I just add one more point to that, because I think that's all the right structural components that ensure we have a culture of quality and a culture of safety. But we've also, I think within the platform, any patient can walk in the door and onto the platform. As long as they have their insurance with them, they can walk in and they can come in for a variety of complaints. I think the principle here is that getting access to care, getting access to a qualified, clinical decision maker that can help evaluate, even if that evaluation is a triage. We think that that's going to create better quality of care for our patients over time. So we're not trying to limit what a patient can come in for on the front end. We've seen folks up in their mid-90s that are coming on the platform that have had recent hospitalizations, that they're just using this as a way that they can actually come and access care. And then, like Prem mentioned, we're able to coordinate it in with all of the brick and mortar if there's a need to escalate, a need to get that person seen, and build kind of the right operational pathways to make sure that happens appropriately.
Wonderful. Thank you so much for those answers, both of you. And I just want to thank everyone, the audience, and our panelists for being here today. This is all the time that we have, but I want to thank Dr. Premkumar and Ethan for an excellent presentation, as well as K Health for sponsoring today's webinar. Thank you for joining us today, and we hope you have a wonderful rest of your day.